You brought up artificially sweetened beverages. This is something I end up talking about a lot. One of the difficulties that people have understanding is the seemingly complete dichotomy of results in research studies. I talk a lot about the human randomized control trials, which pretty consistently show weight reduction when you're subbing in artificially sweetened beverages for sugar sweetened beverages. But then there's a lot of these other studies that show, these low calorie, no calorie beverages, it's linked with 38% increased risk of type 2 diabetes, cognitive decline.
There's the issue around potential reverse causality, because obviously people are being told that if they're having too many sugar sweetened beverages, switch on to an ASB, and then all of a sudden you've got this issue that they're now being linked with weight gain or obesity. And we've got clinical trials now up to a year in length showing that compared to if you take out a sugary sweetened beverage, replace it with a non-nutritive one, you're having favourable changes in terms of weight control. And the same with water, it's relatively equivalent. The last few years it's become clear that they're not inert to say, so they seem to be having a metabolic effect, but they don't seem to be, from what we can see, a clinically important metabolic effect. So if someone's having several hundred calories worth of sugar sweetened drinks a day and they're switching to something which has no calories, there then has to be some kind of mechanism which is then encouraging that person to consume a further several hundred calories per day or greater than that sugary drink, and there's just isn't that evidence there. And even in the RCT data of 6 to 12 months, there's no suggestion of that. So there's just no plausible mechanism to suggest it's a worse option. It's the study design that's key here.
And when you're looking at cohort data, when you're looking at epidemiology, you always have to be open to the idea of reverse causality. Are artificially sweetened beverages causing type 2 diabetes, or are people who suffer from type 2 diabetes more likely to consume artificially sweetened beverages? And I feel very strongly that it's the latter.